Hello and welcome back to CPR Pros or Us. Today we're going to be going over phlebotomy and venipuncture specifically. There's a lot of ways you could perform the venipuncture. And one of the ways is by using butterfly or straight needle. So today I'm going to show you how to obtain blood on a difficult patient, not an easy patient. Like using this AC, for example, it's pretty easy to get that from anyone. However, there are patients who are extremely difficult to get blood from. I know that for a fact because I used to be a phlebotomist for 4.5 years. So let's get right into it. First things first, we're gonna need a device to hold or to extend your veins or vessels. So application of tourniquet is important, just as important as anything else. It's another process. So I see a lot of people doing these mistakes. We're gonna use little baby Whitey here for this demonstration. And I'm gonna show you how it's done. Very quick and easy. So first things, we're gonna go over the whichever limb you're using. You're gonna hold it with both hands, just like so. Then you're gonna make a loop and go right inside, making a tight connection basically. That's how it's done. And then all you do when you're through, you just pull this end and your tourniquet is loose. For me, it's gonna be a little bit difficult to use one hand, so I'm gonna try to do it. So, what are the options? And like I said, AC is one of the easiest veins to get blood from, or to start an IV tap into. However, for the IV, I do not recommend using this AC vein because every time you bend your arm, you're gonna kink that catheter. That's not gonna be good. But we will talk over this IV situation later. I'm gonna make another video about that. So today, I wanna show you options, veins. What are the best spots to get the blood from? As healthcare providers, we're gonna be sticking patients continuously, day in, day out. So regardless who you are, if you're a nurse, if you're a phlebotomist, it's gonna be your routine. So this straight vein right here is good to get blood from because it's a straight line. There is nothing turning, twisting, or there's a good chance of you getting blood. Now, not all patients are as easy, right? So there are other options. For example, wrist venipunctures. They're painful. They're extremely painful. And patients will tell you, I do not want you to poke me in the wrist. However, when there is no other option, you should explain to the patient that that's the only thing that we could obtain the blood from. So, wrist veins, they're there for a reason. They're your resource. So, use it if you don't have any other options. And in some cases, there are not even a wrist vein available. So, today I'm gonna show you, not many people will do this, but I will. And for this demonstration, I'm gonna be using my thumb vein to show you that it is possible to get blood from this thumb. And in fact, I'll show it to you right there. That's the vein that I'm gonna be tapping into. And let's get this started. And just like so. Another secret, when you have your tourniquet applied, ask your patient, work your fist 5 to 10 times to make that vein pop. Another trick, you could tap on the veins if they're visible enough to let them pop. That's actually gonna bring that vein right up, if you can see, right there. And now it's up. So, next step, clean. Nice and clean. Wash your hands before you do any of this. And you could use the butterfly that comes with a hub that goes into the tube. I prefer regular syringe because you have a control of the pressure. So how much pressure you want to have on this vein. I see some people poking into the vein and just suck the stuff right out and nothing's coming out. Well, that's because you're collapsing the vein. Don't put too much pressure on the syringes. Don't do it. It's not gonna work. Or if it is, it's a very good vein. So, all right. Let's get it on, huh? Not right away. And my teacher told me how much he actually told us this is the right amount for any venipuncture. That's all you need to get it right. So you have to get this needle right on top of the skin and puncture with a gentle move. All right, now that's the vein that we going to hit. 1, 2, 3. And sometimes it takes an adjustment. And here we go. As soon as you see that flush, you are in. Remember what I told you. If you put too much pressure on some of the veins, they will collapse and they will not give you anything. So slowly but surely. And for the butterflies, some of them have buttons that just withdraw itself. For others, you have to actually manually pull it out. But I got my sample, it's right here. Now I'll be able to transfer this into the vial, whichever I need. If you enjoyed this video and you found it educational, please follow my channel, hit like, and comment below. Have a happy Friday from Winey and I. Bye.